Question. A 32-year-old woman presents with intermittent fever, weight loss, fatigue, and arthralgia for 3 months. On examination, she has a malar rash, oral ulcers, and tenderness in her small joints. Urinalysis reveals proteinuria, 3+, and her creatinine is elevated at 2.1 mg per deciliter. Which of the following autoantibodies is most specific for her likely diagnosis? A. Antinuclear antibody, ANA. B. Anti-dsDNA antibody. C. Anti-Smith antibody. D. Rheumatoid factor, RF. E. Anti-Rho/SSA antibody. Correct answer is C. Anti-Smith antibody. The patient's presentation of fever, weight loss, fatigue, arthralgia, malar rash, oral ulcers, proteinuria, and elevated creatinine strongly suggests systemic lupus erythematosus, SLE, with renal involvement, lupus nephritis. Autoantibody testing is crucial in confirming the diagnosis and guiding management. Autoantibodies in SLE. ANA, sensitive but not specific for SLE. A positive ANA is seen in greater than 95% of SLE patients but also occurs in other autoimmune diseases. Anti-dsDNA, highly specific for SLE and correlates with disease activity, particularly lupus nephritis. Anti-Smith antibody, anti-SM. The most specific antibody for SLE, though less sensitive, seen in 25 to 30% of patients. Its presence confirms the diagnosis when clinical features suggest SLE. RF. Associated with rheumatoid arthritis, RA, not SLE. Anti-Rho/SSA, seen in SLE and Sjogren's syndrome, but it is not specific and often associated with subacute cutaneous lupus or neonatal lupus. Lupus nephritis. The presence of proteinuria and elevated creatinine suggests renal involvement, which occurs in up to 50% of SLE patients. Anti-dsDNA antibodies are often elevated in lupus nephritis, but anti-SM antibodies are more specific for diagnosing SLE itself.